Hi everyone, I'm Raul Marca, the Interdirector of Prevention for Sexual and Behavioral Health Program at Wyckoff Heights Medical Center in Brooklyn, New York. Today, I'm joining the National Hispanic Medical Association for their DMV Health Fair. I'll be sharing with you some resources for my organization and other resources for other partners organizations have on hand here at the fair. The Prevention for the Sexual and Behavioral Health Program focus on providing comprehensive care and support for individuals in our community, especially around HIV prevention and sexual health. We offer a range of services including HIV testing, HIV primary care, case management, mental health support, PrEP access, and culturally competent care for LGBTQ+ and Latinx population. This commitment is reflected in several ways. Language access services. The medical centers provide interpretation and translation services in multiple languages, including Spanish. Culturally competent staff. Our staff who are culturally diverse and have expertise with working with diverse populations. Community partnerships. We collaborate with community organizations to ensure that its services are accessible and responsive to the needs of the community. Outreach and education. We conduct outreach and education campaigns to raise awareness about HIV and PrEP, particularly among underserved populations. Beyond in-person services, we also have valuable online resources that can help you to learn more about sexual health, access to prevention tools like PrEP, and connect with healthcare providers. You can visit our website or follow us in social media to stay informed and get the support that you need from us. Now I pass over to the NHMA Program Coordinator, Ashley Funes, who will be sharing highlights from some of the other partner organizations that are here at the fair with us, providing important health resources such as HIV screening, flu vaccines, and more. Stay tuned to learn how you can access these resources and take charge of your health, even if you didn't not come out to join us today. Thank you for your time, and we look forward to continue to serve our community together.
We are NHMA. We are the National Hispanic Medical Association. We have been around for 30 years, and we represent the interest of 50,000 medical professionals in the whole United States. So we are very proud to be here with you all. I'm going to pass it over to our COO for NHMA. There you go, Ron. Take it away.
Good morning, everyone. I'm Yvonne Lloyd, Chief Operating Officer and Director of Programs at NHMA. It is my pleasure to welcome you all here today to the Health Fair. We are very excited to have you here, and we are thankful to all of our partners who are here tabling, as well as those who have helped sponsor this event. We hope that you will all have a wonderful day, giving away all of your things, and that we vaccinate a lot of people. So thank you so much for coming.
So we're going to talk a little bit about health because that's why we're here. So first of all, as opening remarks, we're going to have Jorge Ruiz Ortiz. He's a lieutenant commander with the Public Health Service, and he works for the Health Resources and Services Administration. He's going to talk to us a little bit about vaccinations. So, Mr. Ruiz Ortiz, here you go.
Voy a empezar en español porque ese es mi primer idioma y sé que hay muchos aquí que hablan español. I'm gonna say it in English too, so don't worry. Mi nombre es el Teniente Comandante Jorge Muñiz Ortiz. Soy original, nacido en Medellín, Colombia, pero criado en Puerto Rico, en San Juan, Puerto Rico. Y como Teniente Comandante de Servicios de Salud Pública quería enfatizar el hecho, primero darle las gracias a la Asociación Médica e Hispana Nacional por haberme invitado y tenerme aquí y darle la oportunidad de darle unos comentarios para abrir el evento como tal hoy. Quería enfatizar que deben de vacunarse. Quiero dar las gracias a la asociación también por apoyar la campaña de arriesgue menos y haga más para las vacunas contra la gripe, el COVID y el virus respiratorio sincitial. Yo ya me vacuné la semana pasada contra la gripe, así que estoy listo para este año y el año que viene y espero que todo el mundo lo haga también. En parte de la campaña quisiera enfatizar el hecho de que es importante vacunarse contra esas enfermedades y nunca se pregunten cuándo, simplemente cuando tengan la oportunidad, por favor lo hagan. Si tienen alguna pregunta en algún momento durante el evento de hoy, por favor se pueden acercar a mí y los puedo ayudar. Now in English. My name is Lieutenant Commander Jorge Muñiz Ortiz. I was born in Medellin, Colombia. I grew up in San Juan, Puerto Rico. So I speak like a Puerto Rican, but all my blood is from Colombia. So whenever the soccer team plays for Colombia, I root for them. And whenever the baseball team, whenever there's a baseball competition, I root for Puerto Rico. So no matter what happens, I always win. I want to thank the association, the National Hispanic Medical Association, for inviting us here today and having me speak and give opening remarks. So thank you very much. I want to thank the association too for supporting the Risk Less Do More campaign from the Department of Health and Human Services. We want to encourage everybody here to get vaccinated against COVID, against the flu, and against RSV or respiratory syncytial virus. So if you have any questions about vaccinations, or we don't like vaccination hesitancy, we want everybody to get vaccinated. If you're wondering when or when to do it, the most important time is right now. We're facing the flu virus season is starting up, it already started. So we encourage everybody to get vaccinated against those viruses. So thank you very much for having me here. If you have any questions at any time about vaccines, vaccinations, hesitancy, please come to me and I'll help you as much as I can. So thank you, have a wonderful day. Que tengan todos un buen día. Muchas gracias.
Muchas gracias. All right, we're going to continue now with one of our vendors, Natalia Gospodinov, with the Regional Tobacco Control Coordinator for Fairfax County. Fairfax County has supported us in this event, so I'd like to give my shout out to Fairfax County now. But we're going to have Natalia again talk to us a little bit about vaccination and the importance, especially for vulnerable populations. Natalia?
Yes, hi, good morning everyone. It's great to be here. Thanks a lot for inviting me. I'm originally from Argentina. I've been living in Virginia for a few years now. My work currently is mostly has to do with tobacco control, vaping, smoking prevention. But I am a family physician by training, so primary care is my passion. So I'm really grateful to be here today to promote vaccinations. And thank you, Lieutenant, for the great message. I hope everyone will get vaccinated today. I'll probably move on to Spanish a bit. Lo que quería recalcar es la importancia de las vacunas como una herramienta para protegernos no solo nosotros, sino nuestra familia, nuestra comunidad. Lamentablemente hay todavía algunos indicadores de baja utilización de las vacunas, y bueno, sabemos muy bien que las vacunas, y sobre todo las que comienzan ahora en la época del invierno, de la gripe, el COVID, RSV, estas vacunas ayudan no solo a protegernos a nosotros, sino al resto de nuestras familias, y sobre todo ayudan a que evitar las hospitalizaciones por estas enfermedades, evitar las muertes por estas enfermedades o enfermarse gravemente por ellas. Entonces, por eso es que estamos promulgando y motivando a la gente a que vaya a las clínicas y se vacune. Hoy aquí vamos a tener vacunas para la gripe, pero sepan que Fairfax County tiene clínicas donde pueden recibir estas mismas vacunas y también las vacunas del resto del calendario, sobre todo para los niños menores de 18 años los pueden recibir de manera gratis. En mi mesa allí van a tener más información sobre estas clínicas y sobre los horarios y cómo acceder a estas vacunas. Así que, again, thanks a lot for inviting me, having me over here, and I have my table over there if you need more information about this. Thanks a lot.
Okay, so continuing on now, like I said, we are very thankful to the county
for coming here, allowing us this space, and being a partner really with us, because this is really about the community. So now I'm going to have Supervisor Jimenez from the Board of Supervisors of Fairfax County Mason District.
Good morning, everyone. As mentioned, my name is Andres Jimenez, and I'm the supervisor here in Mason District. For those of you who may not know the supervisor, think of it as an alcalde, so kind of the mayor. And it is an honor and a privilege to be here today, and I want to thank the Hispanic Medical Association and everyone for putting this event together. It takes so much time and so much effort to put events like this together for the community, but they are so needed. One of the biggest things that we try to push out in my office is the education component. If people don't know, they don't know. And events like this, doing this during Hispanic Heritage Month, is really important, given that Mason District, where we are right now, is the cultural hub of Fairfax County. We are the most diverse group and have the most Hispanics in any district in Fairfax County, which has 1 million people as a population. So getting out the word, getting out the education, telling the stories, talking about why it's important, making this a community issue, making sure that it's not just about you, it's about your partners, your friends, and everyone around you in the community. So whether you're talking about Alzheimer's, whether you're talking about flu prevention, flu shots like I did with Eric a few minutes ago, talking about dental and making sure that your family and your friends have the proper resources, have the proper information, that is critically important. So I'm really thankful that this event is here. I'm really thankful for everyone who's taken the time out of their Saturdays to be tabling, to get the word out. It's great to see tantos colombianos. Yo también soy colombiano. Soy nacido en Bogotá. Vine acá cuando tenía 3 años. Mis padres ahora viven en Colombia y yo voy a Colombia a visitar mucho. Entonces, qué gusto tener a tantos diferentes partners acá hoy. Qué bien ver a VCU y ver a nuestros amigos de casa que están acá. Siempre nos encanta tener esta oportunidad de partner con la comunidad y con el Fairfax Board of Supervisors. Con eso, te voy a pasar acá hasta adelante. Y muchas gracias por estar acá y muchas gracias por venir. Gracias.
Thank you so much, Supervisor Jimenez. Para nosotros es un honor poder estar aquí, compartiendo en este día que en realidad es un día que tiene que ser de celebración como latinos. Todas las personas que se encuentran el día de hoy deben de sentirse orgullosos que estamos dando pues las bendiciones que tenemos en la vida como el tiempo para nuestra comunidad, para el bienestar de nuestra comunidad. Thank you so much for inviting me. Thank you so much for being here. Thank you so much for coming to Fairfax County and organizing this wonderful event that will definitely have a positive impact in our community. Well, buenos dias. Thank you all for coming together as we discuss the critical role of vaccination outreach in Fairfax County, particularly in our immigrant communities. As we continue to battle public health challenges such as COVID-19 pandemic, our commitment is to ensuring that everyone has access to life-saving vaccines because it makes us remain stronger than ever. Fairfax County is home of a diverse population, with many residents coming from different parts of the world, speaking various languages and practicing different customs. While the diversity enriches our community, it also presents unique challenges for public health outreach. For immigrant communities, barriers such as language, lack of access to information, and mistrust of healthcare systems can prevent individuals from receiving vaccines and other essential health services. Our vaccination outreach efforts have focused on breaking down those barriers to ensure that all residents, regardless of their background, have equal access to the care they need. We have partnered with local community organizations, faith-based grounds, and cultural institutions to deliver information in a culturally sensitive way. This outreach has been instrumental in building trust with immigrant communities as we are seeing the positive impact. The importance of language accessibility and cultural competence in health services, in addition to our outreach efforts, Language accessibility and cultural competence play crucial roles in delivering effective health services. When health information is not communicated in our language, people are not able to understand. So we need to take that into consideration when we're providing a program or service for our community. Or when services are delivered without sensitivity to cultural beliefs and values. We risk alienating entire segments of our population. Language accessibility means more than just translating documents. It requires offering interpreters, bilingual staff, and materials that are culturally relevant. It also means being aware of different ways people might perceive healthcare or vaccines. For instance, in some cultures, there were maybe fear of skepticism toward medical intervention due to past experience, mistrust of authority, or how things work in their home countries. So recognizing these kind of barriers allow us to meet people where they are, just like we are doing today, and offer services in ways they resonate with them. Cultural competence is about fostering an understanding of the values, beliefs, and tradition of the communities we serve. It's about listening to their concerns and responding in a way that shows respect and empathy. When healthcare providers and public health workers are equipped with this knowledge, they can build trust, improve communication, and ensure that individuals feel safe and supported when accessing services. In Fairfax County, we have made strides in offering multilingual vaccination clinics, creating culturally tailored health campaigns, and building partnerships with community leaders who can act as trust messengers. These efforts are essential in closing gaps in healthcare access and ensuring that every resident, no matter where they come from, has an opportunity to protect themselves and their families. In conclusion, I know this is a long speech, I'm sorry, but I just needed to say all this. In conclusion, the health and safety of our community depends on our ability to reach every individual, especially those in immigrant communities. By prioritizing language accessibility and cultural competence, we can create a more inclusive and effective health system. I encourage all of us to continue working together to build bridges, understanding, and trust in our vaccination outreach and health services. Así que estoy muy contento de estar aquí con ustedes. Mi nombre es Carol Escalante, como mencionó el supervisor Jiménez, soy parte del departamento de One Fairfax, especialmente la directora de Asuntos de la Comunidad Inmigrante. Y este tema en realidad está muy cerca del corazón porque, como mi trabajo es con la comunidad inmigrante, me doy cuenta que nosotros tenemos que servirlos en el lugar donde ellos están, porque muchas veces es muy complicado poder entender el sistema de un nuevo país, una manera diferente de hacer las cosas que como se hacían en nuestro país. Entonces nosotros como proveedores de servicios de salud es importante que tomemos en consideración las diferencias culturales, el acceso al lenguaje para poder nosotros ser intencionales cuando proveemos este tipo de servicios. Así que felicidades a todos ustedes por estar el día de hoy. Muchísimas gracias por darme el espacio de proporcionar este mensaje y arriba los latinos y feliz mes de la herencia hispana. Muchas gracias.
Claro, muchas gracias. Sí, es importante decir que nosotros como organización médica estamos aquí para la comunidad, para traer estos servicios a la comunidad. Entonces, estamos muy, muy gratos de haber estado aquí. Así que, adelante, vamos a comenzar el evento ahora y cualquier duda, hablen con nosotros. Todos los que tenemos una camisa azul, everyone wearing a blue shirt is from NHMA. So come talk to us if you have any questions or anything at all. Thank you very much, and let's celebrate Hispanic culture. Thank you.
Hi everyone, I'm Ashley Funes. I'm a program coordinator at National Hispanic Medical Association. Today we're going to be celebrating Hispanic Heritage Month by having our DMV Health Fair. So please follow along. We're going to take a tour of all the partners that we have here and all the resources that they're going to be offering. So follow me. Check out the NHMA staff. Here at our table, we're coming in and you get to see all the amazing resources that we're offering here against COVID, RSV, flu, vaccines. We also have some CDC materials on HIV, some self-test kits, and some other goodies, amazing goodies here, all NHMA as well, and some snacks. Hi everyone. Hi. We're doing a quick Instagram live. Did y'all want to talk about the services that y'all are providing and everything that y'all do? We're from VCU School of Dentistry. We're the only dental school in Virginia. So we're just here to spread some more knowledge about oral health care and oral hygiene. And yeah, we're just giving out a little bit of goodies, reinforcing oral hygiene. That's pretty much it.
Hola, somos VCU Dental, estamos en Richmond. Vemos muchísimos pacientes latinos allá, los podemos ayudar en todo lo que necesiten, tenemos todas las especialidades y si necesitan atención o algo, quieren más información, pueden acercarse a nuestro booth hoy. Estaremos aquí toda la tarde. Gracias.
Gracias. Thank you. Hi, HBI. Did you want to talk about the services that you're offering here today?
Hi, my name is Jennifer, and I am from HBI. We do the house screening today, and then we also mostly we do infectious disease and with cholesterol, and then hepatitis, and then we do syphilis, and then HIV, and we also educate them for PEP. But today, especially for this event, we only do cholesterol and the diabetes, hemoglobin A1C diabetes. Then we also do education for them, teach them how to do it. And then coming up November 1st, we're going to enroll them to the health insurance. If somebody don't have any insurance, they need help, we help them to enroll to Marketplace and apply Medicaid. And then it's a kind of service like look for housing and look for job. And we also help them for that too. Yeah. I think I gotta I need to repeat it.
All right, and here we have.
Hi, everyone. Hello, I'm Dr. Duarte. So I am actually super excited to be a part of the NHMA Health Fair today. I am a Latina dentist, and my purpose of being here today is just to educate the Latinos on the importance of their oral health, preventing cavities, gum disease, because as a Latina, I didn't know that growing up. My parents weren't educated, we didn't have the money. So I want to be able to educate the Latinos on preventing their oral health. So we have goodie bags that include toothbrush, toothpaste, and floss. And I'm also doing a raffle for an electric toothbrush. So yeah, thank you for setting this all up.
Thank you. Thank you for being here. All right. Hi, hola.
Hola.
¿Cómo está? So, estamos haciendo un Instagram Live. No sé si quiere hablar de todos los recursos que tiene.
Hi, everybody. So I'm Dr. Cruz, the orthodontist here. Why is important to align the teeth? Definitely is the longevity of your bite, that you bite correctly so you can have a good digestion and much more benefits. So come to me. I can show you what are the things that you need to look into your kids. If they having problems, we can address it early in life.
Perfecto. Thank you for being here.
Thank you.
Hi. We're on Instagram Live. Did you want to talk about the resources that you have here and everything that you're providing?
Nosotros somos una clínica de odontología general, estamos ubicados en Woolbridge. Atendemos a toda la comunidad hispana, también a la comunidad de acá del área. Tenemos servicios en odontología general, cirugía, también tenemos alineadores, atendemos niños también. Entonces están todos cordialmente invitados. Trabajamos con diferentes seguros y tenemos diferentes planes. Para las personas que no tienen seguros, tenemos diferentes planes, se pueden afiliar con nosotros y tienen diferentes beneficios a lo largo del año, dependiendo de la capacidad y de las necesidades que tengan para poder recibir sus servicios dentales hispanos.
Gracias. Gracias por estar aquí.
Nos esperamos en Sonrisas Dentistry.
Gracias.
Gracias.
Hi. Hi, we're on Instagram Live. Did y'all want to talk about the resources and talk a little bit more about your organization?
The Community Skin Interventions is a student-run volunteer group that focuses on educating the community on skincare, skin protection, especially from the sun with skin cancer, because every single skin tone, not just light skin tones like mine, are affected by the sun. So we can all get skin cancer. We should all wear sunscreen, everybody, every day, all the time. And yeah, we're here giving out sunscreen, mixture of moisturizer and sunscreen, some heavier ointments similar to Aquaphor, Vaseline, itch relief. You can get this at the store. Salicylic acid. It's good for freshen up your face, acne control, and just hydrating cleansers. This is all available at pharmacies, grocery stores, whatever. But we work with the companies to distribute this to people in the community. We usually work in shelters to make sure that people know how to take care of their skin and stay safe. But we're here today.
Alrighty, thank you. Thank you for being here. Okay, welcome back. Y aquí estamos con
Julia Moncada, representando al consultorio dental Chantilly Pediatric Dentist.
¿Y qué servicios tienen aquí? ¿Qué está pasando en esta mesa?
Aquí, bueno, queremos que conozcan todos ustedes lo que es nuestro consultorio. Nuestro consultorio está especializado en niños desde los 0 años hasta los 26 años. Pueden asistir, aceptamos todos los seguros y en caso de que no tengan seguros también son bienvenidos. Utilizamos como una alternativa para aquellos niños que tienen alguna condición especial o tienen muchas caries, usamos el gas, que es un gas de la risa que se llama, o también bajo sedación, la cual no los deja inconscientes, pero sí va a hacer que esa experiencia sea un poco más agradable, no tan traumática como normalmente es ir al dentista. Así que los esperamos. Ahí están nuestras redes sociales, nos pueden seguir por ahí y con mucho gusto agendar una cita y ahí los esperamos.
Bueno, pues gracias.
Hi, my name's Aria. I'm with the Georgetown University Hoya Clinic. We're here today providing vaccinations for anyone who is undocumented or does not have insurance. We are a part of a small committee that we have together, and everyone here is flu vaccine trained, and we also provide blood pressure services sometimes, blood glucose, and so yeah, we're here today to provide all those services for anyone who needs them.
Perfect. Thank you for being here. All right. All right, we're going to make our way around to other partners. Hi. Hi, do you want to talk about your services and what you're offering today?
So my name is Sarah. I'm with Innova Partnership for Healthier Communities. We help families enroll in Medicaid. We also help with the renewal process. And if a family isn't eligible for Medicaid, we help them find other primary care that's free or low cost, such as the Innova Cares clinics. They only accept Medicaid or uninsured patients. And if it's approved for financial assistance, then you can establish care at their clinics.
Perfect. Thank you for being here. All right, and next up, who do we have? Who do we have here?
Hi, I'm Gloria, and this is Nisha, and we work for the WIC program. Should I put this on me? Okay. So we work for the WIC program here in Fairfax County. We have multiple locations, but we work at the Mount Vernon location. The WIC program is for women, infants, and children up until the age of 5. We provide nutrition and breastfeeding support. All of us are bilingual. We speak Spanish and English. We're happy to help you, so come on down to our office and we'll get you set up with some nutrition services.
Perfect. Thank you. Thank you for being here. All right, doctora. Oh. Hi. on to the next table. Hi, do you want to introduce yourself?
Hi, hello, good morning. My name is Natalie Gasparinoff. I'm with Fairfax County Health Department. And I have here all of our resources from the county, information on our clinics, and additional information on vaping and smoking services that we provide through the Virginia Quit Line.
All right, and now we're heading over to the Alzheimer's Association. Hi, do you want to talk about your organization and everything you have to offer?
I can do it.
Yeah, go ahead.
Hi, everybody. Good afternoon. My name is Lauren Smitherman. We are the Georgetown Memory Disorders Program. Basically, what we do is improve access to clinical care and research for underrepresented groups is our priority at the moment. So what we do research. We have lots of trials that are enrolling right now. But really, we're just trying to get the word out about who we are, what we do, and basically what Alzheimer's disease is in general. We partner strongly with the Alzheimer's Association, and we will turn over the mic to them in just a second. But yeah, this is our table today. Follow us on Instagram and Facebook at Georgetown Memory Disorders Program. Yes, so again, my name is Lauren Smitherman. We hope to come see us if you want to zoom in on this right here. This is some of our programming today. We have it in Spanish to make sure that our, it's inclusive for the people that we want to serve today. So if you have any questions, please visit our website, georgetownmemorydisordersprogram.com, and we'll be happy to have you. And I'll pass it over to my colleagues to my right.
Oh, good afternoon, everybody. My name is Michael Watson. I serve as the program manager here at the Alzheimer's Association of the National Capital Area here in the community, just trying to inform folks of Alzheimer's and dementia, the services that we offer here at the association and the chapter itself, and just making sure that everybody in the community knows the signs, the warning signs, symptoms of Alzheimer's and dementia. So on our table, we have many giveaways, brain balls, stress balls, different flyers that kind of talks about that. And we definitely have it in Spanish speaking translation as well, because we want to make sure that we're reaching all municipalities and all folks within diaspora. So we're really excited to be here, happy to be supporting the organization, just happy to be a part of it. So if you have any questions, please reach out, 800-272-3900. That's our 24/7 helpline. Answers any questions about Alzheimer's and dementia. Thank you so much. Thank you.
Also, we are looking for venues to host events. We, like I said, partner strongly with the Alzheimer's Association. If you're interested in us performing and basically getting an educational event at your location or venue, please give me a call at 202-784-8701. We want to make sure we're spreading the word and reaching as many people as possible. So again, if you want to host an event, 202-784-8701. Thanks.
Alrighty. All right. And who do we have here at our fair today?
Yes, we're the Center of Independence. We're the Center of Independence of Northern Virginia, and we are supporting people with disabilities. We're an advocacy center and a center of independent living. So we are empowering individuals with disabilities to with all types of resources and different programs. And we are also having a Latino initiative. As this is Hispanic Heritage Month, we are serving Latinos with disabilities all over the state of Virginia for the Bienvenidos Todos project, and have recently launched our webinars, which this project was actually funded by the Virginia Board of People with Disabilities. So it is in Spanish and in English, 2 different webinars, but we have all types of services, and we're located in Arlington, Virginia.
Wonderful services that we're offering here. All right, next we have Equality Sciences. You want to talk a little bit more about your organization and what you're doing here today?
Sure. My name is Jorge Rodriguez Mazariegos. I'm here with Equality Sciences. And Equality Sciences is an organization that seeks to bring clinical trials and clinical research to communities. We're looking to expand the pool of research beyond those that are traditional academic centers, bring it into communities so that we can find those local physicians, become thought leaders. We can bring data from underserved communities so that we can have drugs that are safer and that are more effective for everyone. So yeah, that's why we're here today. And we're also here today working with Acclinate and BARDA, which are two organizations that are trying to build research into vaccine hesitancy. So today we're looking to learn a little bit more about what this community believes about vaccines and what health programs they're interested in. So we have surveys, and we're here to just talk to the community. That's all we have. Thank you. Thank you.
All right, thank you for being here. We're going to show all of the flyers and materials that they have here for individuals today. All right, next off we have Casa. Hi, do you want to talk about the services and everything that you have to offer today?
Hola a todos, mi nombre es Kenia, soy parte de Casa Virginia. Nosotros en Casa Virginia somos una organización sin fines de lucro que empoderamos a la comunidad inmigrante con lo que ellos necesitan. Tenemos 3 departamentos, uno de los departamentos es educación, salud e inmigración. En el departamento de educación ellos pueden encontrar lo que es clases de inglés, también ayudamos con FATSA y BATSA para los jóvenes que van saliendo de la high school. Nosotros estamos ahí para ayudarles. Ahora la compañera les va a explicar un poco acerca de lo que es el Departamento de Salud. Una cosa más, nosotros estamos también, tendremos un festival el 26 de octubre, esperamos a toda la comunidad, tendremos muchas cosas gratuitas, tenemos flu, vaccines, también tenemos cosas para niños, así que los esperamos a todos.
Nosotros también ayudamos a la comunidad inmigrante, ofrecemos 2 programas de salud, que es lo que es Centara, el programa con Centara, que es para la comunidad en Woodbridge, y también tenemos el programa con Kaiser Permanente, que es otro programa de salud que tenemos para los inmigrantes, para personas que no son bajos recursos. Tenemos también acá.
Hola, yo soy Juana y yo trabajo en el programa de migración con la comunidad inmigrante latino. Aquellos que se quieren hacer ciudadanos, nosotros les llenamos la N400 y también tenemos las clases para ellos para prepararlos en el proceso. Aquellos que quieren renovar su residencia también, y aquí tenemos los servicios en inglés y en español. Muchas gracias.
All right, and now who do we have here?
Hi. So we're with the George Washington University School of Medicine, and today we are checking blood sugar as well as blood pressure. So just be sure to stop by. It's great to check every day. You never know if you have high blood pressure or high hyperglycemia. So be sure to stop by and get checked up. So thank you.
Thank you so much for being here and providing your services. Okay, all right. All right, thank you so much. And then we'll be back and showing other services that we have outside, okay? Now we made it outside of the gym. We have Neighborhood Health here that's going to be talking about their services, why they're here, and why they're so important to the community.
Hi everybody, my name is Chris. I'm the program manager for Neighborhood Health. We're here today at the health fair offering free HIV rapid testing services. We're also offering HIV counseling. Neighborhood Health is a federally qualified health center here in Northern Virginia. We service one of the largest uninsured populations here. Please come on over. We're excited to meet all of you.
Perfect. Thank you so much for being here. All right, we're just showcasing some resources. Hi, we're back. We're with one of the amazing partners that came out today. We're here with
Vincent Lopez.
Yeah, and he is with Metro Health. He's going to be talking about the services that are being provided today for attendees of the health fair. So you want to tell us about Metro Health and what you do?
Sure. So I'm Vincent. I'm our chairman and CEO of Metro Health.
We are a federally qualified health center lookalike in Washington, D.C., in Ward 6, specifically on Pennsylvania Avenue on Capitol Hill. We service all of the underserved community in our city, as well as around our local DMV area. We're offering free vaccines, flu vaccines today, HIV testing, including Rapid Start, that comes with that as well. In addition to that, we have a number of other services that are available at our clinic site, and so we encourage you guys to visit.
Yeah, nice. And what HIV treatments do you have today?
So today we're doing our oral quicks for HIV screening, and then we also have Rapid Start available. So Biktarvy, folks who want to be on the Rapid Start if they test positive. In addition to that, we have doxycycline, doxyprep also known as, and then PrEP as well for folks who are being preventative from HIV.
Yeah, those are amazing services, amazing that you're offering here. I do have a pressing question. Want to make sure that everyone's getting educated. But how does Metro Health help with the access of these HIV prevention treatment options, especially without the ones without insurance?
Yeah, so Metro Health is the second largest Ryan White funded organization in Washington, D.C. And so a majority of our patients are HIV positive or HIV at risk patients, meaning that we are offering services from the actual medical treatment to the full wraparound services, access to home, transportation, jobs, education, etc. And so we focus very much on that and what our work is. But in addition to that, because we're a federally qualified health center, we operate through a sliding fee scale, which means that individuals can actually come and access us without insurance and pay as low as nothing in terms of getting access to care. So.
Yeah, that's amazing. And how do you educate the community about these services that you provide? Like, what are your efforts on that?
Yeah, I mean, a lot of it is coming out to events like this, right? The outreach events, coming out and going out and showing what we do. We have an amazing team behind us that goes out every day to do outreach. And so we really look forward to sharing a lot of those services in those conversations, but also with the community partners that we build, like being here at this organization's event, right? And being able to share what we do and how important it is for all of us.
Nice, amazing. And feel free to take the mic and show us
Sure.
around your booth.
All right, so we got like a little check-in here that's got a number of things, including some giveaways that are here, as well as some material here that's both in English and Spanish that talks about things that we do at Metro Health, but also it speaks about things like that are important to our community and the Latino community. Diabetes, glucose, cholesterol, depression, eating healthy, blood pressure, etc. And so we really look forward to sharing you a lot of that information. We're giving out some of these goodie bags here, and in our goodie bags we have a number of things, including condoms and lube, but also just material that might be useful for you if you're sexually active, but if you want to learn more about the services we offer. Then I take you over here to our van here where we're getting some vaccines done. We're doing the free flu vaccines out here today, and so one of our providers is here giving out shots. And so we see this van out pretty regularly doing testing, and you'll look to your right, we've got the Aura Quick testing as well, which is our rapid HIV testing that we do here. It takes about 20 minutes for us to get a result, and you'll get a same-day result. And if you need to get any other type of medication for Rapid Start, or if you're interested in PrEP or any of that services, we'll then follow up with giving you some of that to go home with. So that's what we do here. And we're out everywhere in Washington, D.C., so come check us out.
Alrighty, thank you. Thank you. All right, we're gonna come around. All right, we're back with Neighborhood Health, and we're going to do a quick little interview. Do you want to talk about, again, the services that you're providing today for people who are attending?
Yeah. Hi, everybody. Today we're here providing free HIV testing. It only takes about 60 seconds. Like I like to tell everybody, the longest part is the paperwork. Aside from that, we're also offering counseling services, and we're also offering our free PrEP case management services.
Nice. Those are great resources that you're offering here today. I do have a pressing question. So what do you see as the biggest barrier in PrEP access for Hispanic communities?
I'd say that the biggest barrier that we find in the Hispanic communities for PrEP access is mostly just lack of information. A lot of people don't know what PrEP is nor what it does, and we're sort of also here to give information about that. En español, para la gente que no sepa en inglés, pues creo que hay mucha gente latina que no saben cuál es el PrEP y qué puede hacer y cómo cómo puede ayudar a la gente. Así que por eso estamos aquí, para dar más información, para ayudar a la gente. Okay.
Perfect. And talking about educating, hablando de educando a la comunidad, ¿qué están haciendo? What are y'all doing in order to, advocate and educate people in the community?
Bueno, una de las cosas más grandes que hacemos en Neighborhood Health es muchos eventos a la comunidad y tratar de expandir nuestra accesibilidad a la comunidad, especialmente para los individuos que no tienen seguro o no tienen las medias financieras para obtener seguro médico. Aquí en Neighborhood Health servimos una de las poblaciones más grandes de personas que no tienen seguro en todo el estado de Virginia y hacemos buen trabajo haciendo eso. Otra cosa que estamos haciendo es siempre estamos buscando para más programas y grant funding para poder expandir nuestros programas y servicios para poder ofrecerle nuestros beneficios a más gente aquí en Northern Virginia.
Amazing work that you do. La última pregunta, last question is, how can Neighborhood Health help avoid losing coverage through Medicaid or families? How do you educate people on that, and how do you make sure they stay covered?
Pues tenemos varios programas para ayudar a la gente con eso, con Medicaid y Medicaid Famous. Nuestro programa de elegibilidad también puede ayudar a la gente que no están cubiertos con esos seguros. Así que tenemos muchos programas que puede ayudar con la gente que necesita ayuda. No solo con Medicaid, pero con Medicaid también. We have programs that help with Medicaid. So if you need help with Medicaid, we can also help with that. So please come to us for any medical needs.
Amazing. Thank you for being here and offering these services. We're really happy to have you here and happy that everyone has access to this. So, we're going to show more resources that you have on the table once again. And thank you.
Barbara, thanks everybody.
Okay, so before she reads out the numbers, this one's going to be for that gift basket right there. Okay, ready?
Camila. El número, días o algo así.
El número es 804480. And then in English, 804480. Camila. Tenemos
Camila Eures o Camila. No se puede leer bien.
There's an email address on the ticket, so we'll be able to.
Paola P303. ¿No?
Pero lo guardamos porque tiene el So this one's gonna be for Camila. So we're gonna do the start of your basket. Luis. Yeah. 804486. Yeah? Oh, bueno! Gracias. Okay, tenemos uno más, es un gift card. One more, a gift card. ¿Qué dice? Luisana. Okay. Tenemos otros raffles del Dr. Cruz. Doctor.
It's off now. It's off now. Oh, okay. Yeah, no.
Okay, doctora.
Okay. Ok, bueno. Gracias. Creo que otro Luis. Ortega o Ortego.
Tenemos el número de teléfono. Si viene 314-465.
Oh my God.
Oh my God.
¿Lo dictó la suerte?
So, vamos a hacer las próximas tres, van a ser para ganarse $500 para tratamiento de referencia. Para usted o algunos familiares.
Demetria Lane.
The phone number is 571
313-9276. Katie Diaz.
Oh my God.
Hey, can I get a? Can you like show the
Thank you.
¿Otro más? Julia Espinosa. The last one.
No, I have asthma. They recommended no, but they will just do better. You're mild. Thank you. Worked out. Yes.
Lietes. Last name Lietes. Haley Lietes.
We're going to do one last one.